Okay, ladies, you're on.
Hello, I'm Dr. Greta McLaren, and I'm here at my clinic, Skin Secrets Med Spa by Dr. McLaren. And today we're going to show you how polyallactic acid, otherwise known as Sculptra, is injected. This is Sculptra Aesthetic. They have an amazing website called sculptraaesthetic.com. This goes in like water, and it pretty much is going to do the whole face. The nice thing about this, unlike fillers, this actually stimulates your own collagen and is going to continue to do so for over 2 years. So when I put it in, when you do a full treatment with 2 vials, you pretty much are going to get to do the whole face. So you might look at Erin and say, well, she looks great, why does she need any volume? Because Erin is at that age, starting in your 30s, where you're going to lose volume every single year. And then you're going to rely on trying to put fillers back to keep it up. Sculptra will keep it up for you if it's done correctly. And you can see where she's probably lost some volume since she was 20. How old are you, Erin?
40.
Okay, so Erin's 40. In her 20s, she would have had more volume right here. She would have had more volume going clear to her ear here and a little bit down in here and of course some in here. So we're going to put Sculptra in all of those areas and we're going to stimulate her collagen. And what's amazing about this product is if you look at their website, they'll show you how patients looked better at 25 months than they even looked at 20 months. So we know that this continues to grow your own collagen for 2 years. It's an incredibly natural look. Nobody's going to know you did this, although they might tell you a year from now that you look better than you did last year. This is Sculptra Aesthetic. It has lidocaine in it. It's very easy to do. It's actually almost like water going in. Most of the time I don't see any bruising with this product. And Erin can close her eyes if she wants. She can leave them open. But it's very simple, and what I'm doing right now is I'm just going to the bone underneath her muscle, and this goes in just like water. But you will see the effect right away because she'll have this volume in her face. Now that's actually the product that went in, but it's also going to numb her at the same time because I have mixed it with a little bit of lidocaine. And cheeks I absolutely love with this product. So you're going to see the difference right away on how this makes her cheeks look. You can see I'm again going from another angle now to do the cheek. Are you doing okay, Erin?
Mm-hmm.
I mean, it's really very easy to have this done. Then I'm going to try to lift here a little bit along her whole cheek line to give you that really beautiful look because we lose so much volume going to the ears. So we're going to put a little bit in this way too. And we find that now the technique we use for Sculptra that really works the best is we're trying to lay the product down on the bone or the periosteum where it's going to stimulate collagen. And it just works so well. What you need to realize is as we're aging, we're losing fat and muscle, but we're really losing a lot of bone. The bone is just getting really fragile below our skin, making our skin look like it's not draping as well, that it's loose. But the question is really, is it loose skin or is that you're losing volume beneath it? So you can already see how pretty that is. I'm going to do a little bit in this nasolabial fold and show you right there. So now if I take this away, you can already see how pretty that looks with just the volume in there. And that's going to go away in about 2 days. She'll look really great tonight to be able to go out to dinner usually. But the water's going to go away in about 2 days and then it's going to continue to improve. We'll start to see results right about 8 weeks. She will need a second treatment at 8 weeks. Another really important area to do is right here because you can almost run your finger here and feel how this gets really negative, right? So the forehead looks really good, then all of a sudden it goes in here like it almost is concave. Then the cheekbones are out here again. Well, when you're younger, you don't have that. This is nice and flush and all just one area. So again, this is a very simple procedure to do, but we want to get volume in here because we want to make this oval complete. So I'm going to have you open your mouth a little bit, Erin. So this is the Sculptra now, and again I'm at the bone and it just goes in like that. And right away you can see where that gave her a little volume up here, and so it's kind of completing that oval. So we like that as well. How you doing?
Good.
Is it bothering you? She has no numbing. She's on no medication. She's starting to feel a little numb here now, but you can see how pretty that whole side of her face looks. The other area where we lose a lot of volume is right here. You end up with getting a little jowl here. So another really good place to go is down here. And again, you're trying to just fill in this negative, and you can almost run your fingers in here and feel how you get negative right in front of that jowl. But if you complete this line, this straight line, then it really does help take that jowl look away. And I just went under the muscle there, and all I'm doing is creating this straight line here. Another really good place for Sculptra in somebody Erin's age, because she doesn't have a lot of loss anywhere, is she starts to lose this definition back here as well. So her jawline looks good, and then it's starting to just sort of round off back here rather than be a nice straight look, which you have when you're younger. So this is another area just below the ear that I like to put some in. And women with facelifts really, really need this, because when they have a facelift, you're just pulling your skin back tight over the loss of bone. So you really want to add this definition back here. And since you can't go in and add more bone, what you're trying to do is stimulate your own collagen and have that happen. You want to stay away from the hollows in here, obviously. But look at how pretty this looks on her already. And we're almost done with this treatment. We just have one more. So I'm going to do a little bit more under her chin right here, because this is another area that really starts to go away. And as soon as we finish this last syringe, you should be able to tell, even though it's subtle, the difference between this left side of her face and the right side. And where I want to put a little more volume in her, everybody's different. So I do all of my own injections here, but I have to kind of look at everybody's face and decide where do they need it the most. So when I'm looking at Erin, she's got absolutely gorgeous cheeks. That's kind of her highlight, the fact that she has such great contour. Bled a little bit. But what I'm wanting to do on her then is, once again, kind of bring up her cheeks a little bit and help lift. So I'm putting a little more in there. So you can see that bled a little bit. Most of the time we don't see any. And if I just hold pressure here, this is totally going to stop. And she'll look really good to still be able to go out tonight. And then I'm going to continue this on her. I know it's a little hard to see because I'm holding this gauze. But this actually was an entire vial of Sculptra now. So this whole side of her face is gone. Do we have Cetaphil? I'm going to do a little bit of massage with Cetaphil. And after you do this procedure, we do want you to do a little bit of massage. But you can see if I just hold a little bit of pressure there, that's going to stop. I doubt she's even going to bruise. And then you do need to do this massage at home, but we show you how to do that. And this is just Cetaphil, so it won't break her out. Okay, so you can look at her right now. She just had the entire vial put in this side, and look at how good she looks. And when she turns to the side, that's how she looks. We can put makeup on her right away, actually, if we just wait a few minutes for these little teeny holes to close over. And she could actually go out tonight. So there's the difference if you want to do a close-up of that. And then I'm going to do the other half of her face here in a minute. But this kind of gives you an idea of where I put the fluid, why I put it, and how I want it to stimulate collagen in all of those areas. And I think it's just a really, really pretty look. And again, I want you to turn to the side because I love the way it lifts the whole cheek up here. And this is Dr. Greta McLaren, and we do offer all of our specials if you want to offer us your texting to get messages from us, that you can text 797979 to the word secrets, that's plural, 797979 to secrets. And then you can stay abreast of all of our health tips, alerts, specials, etc. We are having a great sale right now on Sculptra, but this is more just to show what you can do instead of a facelift to add volume back that'll last for 2 years or longer without having to do fillers all the time. And thanks so much for watching.